Feeling stressed, anxious, struggling with your mental health in any sort of way, you're not alone, and help is just a click away. Imagine receiving top-notch mental health care without ever leaving your home. Well, telehealth actually makes that possible and offers people convenience, privacy, and accessibility to specialists regardless of any location. With virtual psychiatric care, like at my practice, Donna Wellness Clinic, you get expert psychiatric support, aka from me, from the comfort of your home, with no commutes, no waiting rooms, and it's 100% confidential. It's a modern approach to mental wellness designed to fit seamlessly into your life. The ability to experience therapy and/or medication management that's flexible, comfortable, and tailored to your needs with extreme accessibility, aka even from your couch, your car, on your lunch break, or your bed, it's all there and it's all available due to telehealth and virtual care. Hi, I'm Dr. Marie Donna. Today we're diving into the world of virtual psychiatric care and exploring how it can be a game changer for patients seeking mental health support. So let's talk about all the reasons why you would consider virtual care. Number one is accessibility. Virtual care breaks down geographical barriers, allowing individuals in remote or underserved areas to connect with mental health professionals without the need for long commutes, not needing to worry about the traffic or issues that can come up with a lengthy drive or a lengthy commute. This means that quality care is just a click away, no matter where you live. Next, convenience. Scheduling becomes a breeze with virtual appointments, offering flexibility that fits into your busy life. You don't need to miss work or school by taking the time to schedule in the commute, traffic, etc., because it can be done basically anywhere. There's no more waiting rooms or adjusting your entire day around a single appointment, which, trust me, even as a physician, I've had to play that whole song and dance of sitting around in a waiting room, canceling my whole day of patients, and I hated it. But with a virtual psychiatric care, and like in my practice, that's not what's ever going to happen to you. Next, let's talk about comfort. Being in your own space can make it easier to open up during sessions. Discussing personal topics from the comfort of your home or another private space can reduce anxiety and promote honesty. It's really hard to be honest and vulnerable from time to time, but if you're feeling comfortable by being in your own space, that's going to open the door for more help and support when it comes to your mental health and wellness. Privacy. Privacy is another key benefit. Virtual sessions eliminate the chance of running into someone that you know in the waiting room, and this added layer of confidentiality can make seeking help feel safer. Just all psychiatrists, mental health professionals definitely try to be confidential when it comes to any support that you receive, but there is just a lot more confidentiality that can come when you are doing virtual care and doing it from the privacy of your home. Continuity of care. Continuity of care is crucial, and virtual appointments ensure that you can maintain regular sessions even when life gets hectic. So illnesses, lack of transportation, or other issues or concerns don't become that big of a concern. Whether you're on a trip or facing unexpected events, your mental health support can remain consistent. Reducing stigma. So I'm huge about trying to reduce stigma against mental health, but virtual healthcare can also reduce the stigma associated when visiting a mental health clinic. I hate how there is still a stigma against it, and we really should try to combat that, but that at least won't be a concern if you're doing a virtual visit. Receiving care discreetly can encourage more people to seek the help they need, say if that was something that was discouraging them from doing so in the first place. Cost effectiveness. Finally, virtual care can be cost-effective. It reduces expenses related to travel and time off work. This makes healthcare support more accessible to a wider audience. Now, let me try to address some concerns that people might have when it comes to virtual psychiatric care in my own clinic. The number one concern might be virtual care feels impersonal. I prefer face-to-face interactions. Well, at my clinic, and I'm going to say honestly for most virtual clinics, I think we'd like to prioritize personalized, compassionate care, whether in person or online, virtual or not virtual. But with virtual sessions, they allow you to connect face-to-face with a dedicated person like myself, a psychiatrist, face-to-face in real time, and hope to create a safe and supportive environment just like any office visit. Many of my patients actually find that meeting from home actually helps them feel more comfortable opening up. And yes, sometimes it is different being in a room versus not being in the room, but I'm gonna say, honestly, with the technology nowadays, you'll see people with facial gestures and hand gestures and be able to convey their emotions just like in person. So it hasn't been something that honestly has been a big problem for me when I'm seeing my patients virtually. A number two issue that can come up is that technology can be frustrating. And I get it. Technology can be tricky sometimes, but that's why at my clinic in particular, we use simple, secure platforms such as Doxy.me that works on any phone, tablet, or computer with just one click. Plus, my staff can help support and guide you through the setup and troubleshoot any issues so you can focus on what matters, your mental health and your well-being. And if there are any other issues, I'm more than willing to help try to navigate it with you long term. And if you do need to be seen in clinic, that can be discussed. But honestly too, with patients that have had that concern, we've all been able to meet pretty seamlessly. Another concern is, what if I need medication or crisis intervention? I'd like to think in most clinics, but even at my clinic, I'm licensed to prescribe and manage medications when appropriate, just like any in-person care, in-person facility. And if you're ever in crisis, I'll make sure to help you get the support that you need, including referrals to a local emergency service or in-person care if necessary. Your safety and well-being should always come first. And honestly, with a virtual clinic, just because there's more convenience and not as many time constraints with having to commute and all of those things, this is where we can address your needs even faster. Number 4 concern is, it's hard to find privacy at home. I'd like to think in most clinics, but especially at my clinic as well, Donna Wellness Clinic, confidentiality should be a top priority, and we understand that a private space can be a challenge. But many of our patients choose to have sessions from their car, a quiet room, or even a walk outside where no one else is around you. With virtual care, there's also flexible scheduling, so you can find a time that actually works best for you to talk freely and comfortably. Another concern is, does insurance actually cover virtual therapy? And yeah, great news. Many insurance providers now cover virtual psychiatric care or reimburse you for it while providing super bills. And at our clinic, we'd be happy to help you walk through these options. Ever since COVID has happened, virtual care is just so much more prevalent and so much more convenient for so many people. Virtual psychiatric care offers numerous benefits that cater to modern-day needs, making mental health support more accessible, comfortable, and effective. If this video gave you more clarity and insight into virtual psychiatric care and how it could be beneficial for you, please explore my other videos for more insights into your mental health care. And if you have any topics you'd like me to cover, let me know in the comments. And again, if you are located in the states of Florida, Pennsylvania, Washington, D.C., or New York and looking for a psychiatrist, I'm accepting new patients. Let's keep the conversation going and prioritize mental health together. This is Dr. Marie Donna.